All right. Good afternoon, everyone. I have 3 o'clock. It's time to start the December 15th Health and Human Services Committee meeting. We're going to do the roll call first. So, Mike, if you would please get us going.
Yes, Chair Smith.
Present remotely, Clinton Township, Macomb County, Michigan.
Commissioner Duge.
Present, Warren, Macomb County, Michigan.
Commissioner Sauger. Commissioner Klein. Commissioner Romano.
Commissioner Romano, District 4, Sterling Heights, President participating remotely in Macomb County, Michigan.
Commissioner Myjack. Commissioner Brown.
Commissioner Brown, present remotely, Washington Township, Macomb County, Michigan.
Commissioner Kraft.
Commissioner Kraft attending remotely, Chesterfield Township, Macomb County, Michigan.
Commissioner Leonetti.
Commissioner Leonetti attending remotely and present from Mount Clemens, Michigan.
Commissioner Haw.
Commissioner Haw, present, attending remotely, Roseville, Macomb County, Michigan.
Commissioner Lucido. Chair Smith, that completes the roll. I do know that Commissioner Sauger is still trying to enter the room, and so staff will continue to work with him and get him in the meeting.
Okay, thank you. Next item on the agenda is the Pledge of Allegiance. Please rise and recite the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Item number 3, I need a motion to adopt today's agenda.
Romano, adopt the agenda. Supported by Commissioner Brown.
Thank you. I have motion and support. Please vote.
That motion passes 7-0.
Thank you. Item number 4, 4A, motion to approve the minutes dated November 9th, 2020.
So move, Haw.
Support, Duge.
Thank you. I have a motion and support. Please vote.
That motion passes 7-0.
Thank you. Item number 5, public participation. First public participation is for items on today's agenda only. If you would like to speak, please unmute by pushing *6 or type into the chat, and one of the staff will let me know. Any members of the public wishing to speak? Any members of the public wishing to speak? Third and final time. We will have another public participation at the end of this meeting. We're going to close public participation. Item number 6, 6A, Budget Amendment, Health Department Grant Fund for the MDHHS Comprehensive Grant Agreement for $503,215. Can I first get a motion for that?
Motion to approve, Duge.
Thank you. Guys, support?
Support from Kraft.
Thank you. Who is on the line to speak to this?
Commissioner, this is Bill Rodella.
Thank you, Bill. How are you?
Good, thank you, thank you.
Floor is yours.
Thank you very much. Good afternoon, Macomb County Board of Commissioners. I am bringing an item that will increase, and again, it's a request from the department to increase our fiscal year 2021 budget through additional grant funds from the Michigan Department of Health and Human Services by $503,215. The majority of this, $473,215, is for case investigation and contact tracing through our coronavirus relief fund grant. This will support personnel costs and operating and some of our contractual costs, which are additional staff doing this work. Some of this is a rollover from the prior year into this year, but the state allowed that, and we are therefore have to increase the fiscal year 2021 grant by that amount. We also have an additional $30,000 supporting our family planning program to, again, increase services and costs within that program. So, again, I am requesting budget amendment approval by the board.
Okay. I don't have any speakers. So unless I am missing something, commissioners, please vote.
That motion passes 7-0.
Thank you. Thanks, Bill. Item 6B, budget amendment, veteran services, MVAA grant for $113,818.90. Laura, are you here to speak on that?
Yes, sir.
Okay, hi. Hello.
Hi.
Can I get a motion first? I'm sorry. Can I get a motion for this, please?
Motion by Romano.
Thank you. Support?
Support from Kraft.
All right, thank you. Laura, go ahead. The floor is yours.
This is our third year for this grant. This is from the state to do veterans programs and to bring more veterans to our office. So half of it's going to go to advertising. We have some going towards more free dental days for veterans, and we have some going for PTSD exams. And that's pretty much what this budget's going to be in a nutshell. Last year we got $300,000. This year we got $113,000.
All right. This has already been awarded. Okay. Let me see if we have any speakers. Commissioner Brown.
Mr. Chairman, I'll pass. Thank you.
Okay. Let me ask this, Laura. I'm not sure. I think our staff asked us. I don't remember signing this. Do we already have this money, or is this a request for approval? This is not my committee. So.
Okay, so we usually get $25,000 up front, and then this is a reimbursement quarterly. And they reimburse us what we spend. And we had to get it approved before the approval process starts in September, submitting all this, because this is a fiscal year grant. And we started this in September on how much we were getting and what we were going to spend it on. And then the state approves it. And now they signed the agreement. JP signs the agreement. And now it's just loading the money so I can spend it.
Okay. I'm not sure. Maybe I got this wrong, but normally to approve grant money coming into the county, it still has to be voted on by the board, even though obviously we would
Right.
vote yes.
This has not been voted on yet.
Okay, so that's what this is?
Correct.
Okay, thank you. Then I don't see any other speakers. So I guess we'll vote to move this to full board. Please vote, commissioners.
That motion passes 7-0.
Okay, thank you. Let me look at this. Item 6C, this also is veteran services. So can I get a motion for this one? And then it looks like the next bunch are all going to be community action. So can I get a motion?
Motion to approve Ducey.
So move, Haw.
All right, thank you. Laura, the floor is yours again.
This grant is the grant that I've been applying for 10 years for the IRS, and we finally, woohoo, got it awarded. Thank you for using a fiduciary. So it actually is going to go through the United Way, and we are a sub-grantee through United Way. So this funds like a few things, like 2 personnel to run it. It funds a security person / janitor at the FRC. It also funds a financial person to educate the community on financial, how to save your money and save your refund and all that, which we're going to be offering on Saturdays.
All
It's a small grant, but it makes the world of difference to this program.
All right. It sounds good. I was talking about this. Any speakers on this? I don't see any speakers. So, commissioners, please vote.
That motion passes 7-0.
Thank you. So 6D, E, F, G, H, and I all have to do with community action. If anyone would like to make a motion for all of them, we could let Ernest speak to all of them, or if anyone wants to separate them out, please feel free.
Motion to approve all.
Support for all.
Okay, I have motion and support for 6D through I. Ernest, are you there?
I'm here. Can you hear me, Bob?
We can, yes. Welcome.
Well, thank you. You know, we're getting here to the end of the year and our CARES funding, so we have a range of approvals here. I'll just walk through them quickly and answer any questions you have. That first one for utility bill assistance, that's an increase of state CARES funding we're receiving through the Bureau of Community Action and Economic Opportunity. Throughout the year, the BCAEO, which is the bureau that deals with all community action across the state, has been a strong advocate for us with MDHHS. And so that's some additional money for utility bill assistance. The next item, number E, is a similar opportunity for CARES support. We had determined that the county CARES funding was eligible to cover some of those utility bills. And so what we had done is we had requested the state of Michigan to allow us to use our CSBG funding for what only that could be used for. And again, that goes into 2021. And so that was one where we had used some of the county CARES funding, that $305,000, for expenses that could have been spent under the state of Michigan money, with the understanding that that would allow us to stretch our state of Michigan CSBG money farther into 2021. The next one, letter F, is around the SHIP program you've all heard about. We're seeing a tremendous response and are looking to expand that as well in the final December push. Letter G is around one of our strong programs, the supportive services for veterans and families. It's really been a strong program this year, especially during the pandemic. We provide a range of relief to veterans who are experiencing homeless, and we work to help prevent homelessness in the first place. That's through a partnership with the Oakland County Community Action Agency, which is the Oakland Livingston Human Service Agency. Letter H is a budget neutral request where we're shifting some money around within the Head Start program. We're shifted it around so that we could support more virtual learning and remote instruction, which we were forced to do due to the school closures, and also provide a range of extra PPE. We have some air purifiers and a range of additional equipment that allows our home-based child care partnerships to be able to provide care safely and increase their safety standards for COVID protection. And the last one there is letter I, which is around one of our Trauma Smart programs for Head Start. The Oakland Livingston Human Service Agency and Macomb Community Action were awarded an innovation grant nationally from Head Start to undertake this work around trauma. And we had projected out our costs in that program that were being supported by the Community Foundation for Southeast Michigan. We had projected higher than the actual award ended up being, so that decrease is just to true up the actual figures that were originally projected. And that is D through I.
All right. Commissioner Brown.
Thank you, Ernest. The SHIP program, the service area doesn't cover the entire county. There's parts of the northern part of the county, which includes half of my district, that currently they're not able to reach. Is there any plans to reach them?
You are correct, Commissioner Brown. SHIP has some limited service areas, especially in rural regions, related to the distance from the store itself. I do know that we are working with them. We're advocating for additional coverage. I personally don't know what logistics or capacity constraints they think would make this feasible or unfeasible. All I can tell you is that we do know that there is that restriction, and we are expressing our interest to expand it to all Macomb County residents.
I know we have some rough roads out there and wagon trails that are hard to get out there, but there are a lot of people that live out there and could use those services. And I'd be curious to know what logistical issues they're facing. Maybe we can help them locally, figure that out.
Sure.
So
Well, glad to take your concern to them. I know we have Sheila Cote from the Office of Senior Services here. If she has information about their request for expanded service.
Hi, Don. Part of the concern is getting shoppers to drive that distance. So if it's more than 20 minutes from the store, it's difficult to get shoppers to agree to take that job to deliver the groceries. So the SHIP representative is working with other vendors or retailers to try and engage them in that part of the county. I haven't heard back recently where they are with that, but we are, again, like Ernest said, strongly advocating so that we can provide that service to the northern end of the county.
Okay, I've got some questions or some questions / maybe a help, but we'll talk offline, Sheila. But thank you for the information. Thank you for your report. Continued good work by both of you. Thank you. Thank you, Mr. Chairman.
You're welcome.
Thank you, Commissioner. I don't have anybody else, but Ernest, on the SHIP program, I just had a question for you. I know I think you've expanded it, at least the timeline to sign up, but I know a couple people that signed up the first day and they said they were going to hear something within 2 weeks and they haven't heard anything. So I'm wondering, are there some glitches or who do I need to tell them to call if there are some problems? I don't know if you even know that there might be some problems with it.
I'll let Sheila speak to that if she knows about any delay in enrollments.
Okay.
Yeah, Bob, there really is no delay. What the issue is processing those memberships.
Okay.
So we're sending them through snail mail. And we're entering all of those into our database, which is very time consuming and labor intensive. So the individuals that you know should be receiving the mailing within the next week or two. If they don't, they can certainly call our office and we will make sure that they get the membership. Okay. There really is no deadline. So once we have their name and their information, they will get a membership. We're just dependent right now on the snail mail. So it's holding things up a little bit.
Okay, sounds good. I'll let them know. Thank you.
Will do. Thanks.
All right. I do not have anybody else signed up to speak. So if everyone would, we have a motion and support. So commissioners, please vote.
Jogger votes yes.
Thank you, Marv. Welcome.
That motion passes 8-0.
Thank you. Item number 7, Martha T. Berry monthly report. Kevin Evans, can I get a motion, please, to receive and file?
So moved, Kraft.
Thank you.
Support, Brown.
All right, I have a motion and support. Kevin, are you with us?
I am. Thank you, Mr. Chair. Thank you, Commissioners.
The floor is yours for 3.5 minutes.
All right.
Just kidding. Go ahead.
Thank you all for all the conversations we've had throughout the years. I know that some of you I will not be seeing again, but I hope to see you in other venues. Congratulations. And I want to say thank you for all the great support to Martha T. Berry. Our holiday this year is a little bit different. As you know, we normally have some great events that we've had, but instead we're doing some things internally because families can't come in. So we'll be having our own teams doing Christmas caroling. We will be, we have some hospice people coming in and doing some music that we'll be recording and putting on our internal TV systems. Also, a fun one, we're putting a couple of our Christmas trees up in one of our larger foyers and having the residents be hunters. Myself and a couple of our staff will be wearing deer antlers and we'll be poking our heads in and out of the trees so that they can shoot at us. That should be cathartic, I'm sure, at some level. Right now, because of the positivity rate in Macomb being over 10%, all of our staff are required to be tested twice a week. I'm also pleased to say that that we invited the state director for licensing and regulatory affairs, Bureau of Health Systems, Larry Horvath, to our facility with Michelle Repke, who's the federal survey director. They came and reviewed our processes and asked if we would be the facility that tests all of the surveyors in Southeast Michigan. So every Tuesday we are now testing all of the surveyors for Southeast Michigan long-term care. I want to also thank the cooperation that we've had with the county. So many departments that we've worked with, Ernest and Sheila's team on making sure we were able to stay open and stay safe through the Goldenberry programs. Bill Rodella's team on helping us really navigate COVID-19, just an amazing job. The finance department helping us with the initial CARES Act funding, and then also when we recognized it was going to be longer, committing to helping us with extra funds that were, as they were available, when we realized we had to do more testing than they did. Really helped us go a long way to manage our expenses, especially the COVID-related expenses. Our vaccination program, you may have heard that HHS Secretary Lazar said, hey, I think we can vaccinate every nursing home resident before Christmas. That news story just came out. I hope they withdraw that one because it just isn't feasible. When you think about everything that's happening to get vaccinations to 16,000 nursing homes, Walgreens and CVS needing to hire all the nursing teams and get all the syringes alone, let alone the logistics and the documentation that's required. Tomorrow I have a call with Walgreens to set up our first clinic in our facility for our residents, but that will not, they told us already that the earliest it could happen for us is in January, and the first one that they're going to have is the 28th of this month. So there's a lot going on with that, but we intend to do our best to get as many people vaccinated in the first round as possible. With that, I think I did it in less than 2 minutes. Mr. Chair?
Oh, Mike, you surprised me. Sorry about that. I was expecting a much longer report, Kevin.
No worries. It's the holiday season. I see everybody wants to go right now. So,
Don, unless I'm not sure if you're still on from last time or not, Don, but I have you up again.
Yes, I do. Thank you, Kevin. So what is the infection rate in the Martha T. Berry presently? How many people have COVID? How many people? Where are you at with that?
Thank you for asking, Commissioner. We currently have one resident in our building with COVID that was admitted from their own home, and that has been the case pretty much since May. We've only had one that we could potentially link to a staff member. We've had, since May, we've had 43 staff test positive, but because of our source control and again, Emergency Operations Center helped us with PPE. We've only had one suspected but not confirmed case of cross-contamination. It's just been really, our team's done a great job. And that was one of the things that the directors complimented us on was our processes, because they didn't want their surveyors to come into a place that just didn't know how to take care of infection prevention.
Any deaths due to COVID in the last, or since this process has started, or this pandemic has started?
Well, if you
related
recall,
related to COVID.
Yeah. In March, if you remember, in March we had a number of deaths, March and April, and if you do recall, that was when they didn't really know much about the disease. They told us not to mask up, save the masks for hospitals. They were actually diverting PPE from nursing homes to hospitals and EMTs early on. And then they realized that the vast amount of infections occurred prior to symptoms. But up until, I believe it was the third week in March, they said, don't mask up unless you have symptoms. So we learned a lot from it, but unfortunately we did have a number of deaths early on. But since May 8th, we have not had a single death related to COVID-19.
Great. That's what I was trying to point out. So very good. So your processes have been working and they continue to work. So much so that people from the outside want to come to our facility for testing. And that's a credit to you and your staff. So that's duly noted. Thank you, Mr. Chairman.
Thank you. So, Kevin, you're saying that since you haven't been forced to take COVID patients from hospitals, everything's been going well.
Yes. Well, yeah. We have, again, we've admitted people that tested negative, but we put them in our isolation area for observation, and 3 days later they test positive. So we know that the viral load wasn't sufficient to get a positive test at the hospital, but we know that due to contact tracing that it came from the hospital because we had nobody in our facility that had it at the time. So that's happened on several occasions, and that's the reason why we have somebody right now.
Great. Well, as always, and to echo what Commissioner Brown said, you're doing a great job there. We're proud of our facility, and a lot of that has to do with the way you run it. So thank you. I don't
appreciate the kind words. Thank you.
I don't have any other speakers, so
I'd like to make a comment.
Go ahead, Marv.
Yeah, Kevin, we've had a lot of directors over at that hospital, and I've always supported them. But you go right at the top of the list with the ones that I knew. You've done a great job. You've done me personally well, and congratulations, and keep up with the good work. Thank you.
Thank you, Commissioner. I appreciate the kind words.
Thank you, Commissioner. All right, with that, please vote.
That motion passed 8-0.
Thank you. Item number 8, correspondence. Can I get a motion to receive and file the Veterans December newsletter?
So move, Hall.
Thank you.
Support Romano.
Thank you. Please vote, unless anyone would like to speak about it. Take that as a no.
That motion passes 8-0.
Thank you. Item number 9, new business. If you don't mind, I'll start on new business. I forgot to do this at the beginning of the meeting. And although I didn't know Sal Rocca, I know a lot of people that did. And I know he just passed away recently. He was a member of the BOC in the House of Representatives. And I really can't speak much to him like some of the other commissioners can. But if we wouldn't mind having a moment of silence in his honor. Thank you, commissioners. I've heard great things about the man, and if anyone else would like to speak, that's the only thing I have today. Any other?
Mr. Chairman, I'd like to say a word.
Yes, you may.
Yes, thank you. Yeah, Commissioner Rocca was in the line of Macomb County's maverick politicians. I mean, he broke the mold. He's among the best politicians with the political minds that I've known in the county. He obviously, as all of us do, we worked with both Republicans and Democrats, and that made him an unusual preacher in Lansing when he went there, because they still don't really understand what goes on down here in Macomb County with us working in a bipartisan fashion to get so many things done. But he always had a sharp political mind, and he brought a lot of skills from the legislature when he served with us here on the Board of Commissioners, like so many others have done. And he was a remarkable man. He liked to hunt. He loved the outdoors. He was very in touch with his community. He was just a very, very sharp man, and I'm sorry to see him go so young. And his wife, also who served with us on the board, was also skilled. But Larry was a patriarch of his family, and a political family at that has served this county very well. And it's a real loss. And I've learned a lot from him through my time serving with him and watching him from afar. And it's just a loss, but everyone passes, I guess. But it's sorry to see him go. He'll be missed. Thank you, Mr. Chairman.
Thank you, Commissioner. Any other commissioners with any new business or anything to say regarding this topic? All right, commissioners, we're going to go to public participation. Item number 10. Any members of the public wishing to speak on any item? You have 5 minutes. Please unmute and tell me your name and your address, city of residence. Unmute by pushing *6 or chatting on the line. Any members of the public wishing to speak?
Bob, this is Bill Rodella. Can you hear me?
Hi, Bill. Yes, I can.
I'd like to be able to say a couple words.
You are up.
Okay, I just wanted to let everybody know this is my final Health and Human Service Committee meeting, and I'm going to be retiring after the first week of January. And I want to know and let everybody know it's been a pleasure to work with all of you throughout the over 8 years that I've been with the county upon returning from my original employment back in 1979. And I truly appreciate the respect from the Board of Commissioners and your attention to the needs of the Public Health Department. It's not just throughout this pandemic, but throughout my tenure here. And look forward to the new year and you guys having, again, a new Public Health Director appointed at some time soon. So thank you, Mr. Chairman. I just wanted to convey those words as I'll be leaving in the end of January. And now that vaccines are coming, it is a beacon of light of being able to work with many in the community of addressing this pandemic on the offensive instead of just the defensive.
Fantastic. Well, Bill, I apologize because I was assuming I'd probably see you on the last full board meeting that I'm going to be at, which will be later this week. So hopefully I can talk you into tuning in then. But we, in case you don't, I will say that it's been nothing but positive working with you at the health department. Everybody that I know respects you and loves working with you because you're such a gentleman and you've done a great job there. And Macomb County and the board is going to miss you for sure.
Thank you. Appreciate that, Bob. Thank you.
Thank you. Any other member of the public wishing to speak? We have 5 minutes. Any third and final time? Any members of the public wishing to speak? We're going to close public participation.
Motion to adjourn, Dujay.
Commissioner Dujay and any Romano. We have a motion and support to adjourn. Please vote. I'm going to go with that's passing 8-0. So meeting adjourned. Thank you, everyone. We'll see you, I think, Thursday.